Let's study the most important topic for NCLEX, that is acid-base imbalance. Okay, let's start with respiratory acidosis, which is also known as hypoventilation. There is low and slow respiratory rate. You can remember this point as a acidosis, like slow and low. So this is the condition where carbon dioxide builds up in the blood or carbon dioxide retention occurs in the blood. There the pH level is less than 7.35, where the blood becomes acidic, and there the partial carbon dioxide level increases more than 45 mmHg in the blood, and bicarbonate level may remain or elevate in chronic condition to compensate. This condition can occur like conditions which causes an obstruction of the airway leading to hypoventilation, such as sleep apnea, COPD, head trauma, post-operative cases, asthma, atelectasis, bronchitis, pneumonia, central nervous system depressants like benzodiazepines, like sedative medicines, and then the opioid overdose also causes the respiratory acidosis. Opioid overdose medicines like morphines. Now the clinical manifestation of these conditions are lethargy, mental status change, confusion, dizziness, dysrhythmia, headache, coma, decrease in blood pressure, muscle weakness, seizures. Treatment of these conditions is mainly the oxygen therapy, but in severe cases, treatment options are non-invasive ventilations and mechanical ventilations. In case of non-invasive ventilation, we use CPAP and BiPAP, which has to remove unnecessary carbon dioxide from the blood. And in case of mechanical ventilation, we intubate to the patient. It's used in case of severe respiratory failure or altered mental status. After analyzing arterial blood gas of patient, these treatment are the options. So caution in COPD is that increased level of oxygen may suppress the respiratory drive. So we use limited amount of oxygen in case of COPD. The normal arterial blood gas values are: normal pH is 7.35 to 7.45, normal partial carbon dioxide level is 35 to 45 mmHg, then normal bicarbonate level is 22 to 28 MEq per liter, normal level of oxygen in the blood is 8200 mmHg. To define difference between alkalosis and acidosis, you have to know these values. Okay, let's go to the respiratory alkalosis. This is the condition of having fast respiratory rate. The pH level increases greater than 7.35 in the blood, or blood pH abnormally becomes high. This condition is also known as alkalosis. Key manifestations are low partial carbon dioxide, that is less than 35 mmHg, and low bicarbonate level. To remember this condition, you can think of a person panting like a dog, and you can also remember fast respiratory rate like alkalosis, increasing in the respiratory rate. And in this condition, there is increased level of metabolism, which results in the overstimulation of respiratory system. This condition is also known as hyperventilation, where there is a rapid respiration, blowing of carbon dioxide, leading to a decrease in carbonic acid in the blood. So, hypoxia is also the reason of the respiratory alkalosis, which stimulates the respiratory center in the brain, which also causes an increase in respiratory rate in order to get more oxygen. This causes hyperventilation, which results in decrease in carbon dioxide level in the blood. So other conditions that causes respiratory alkalosis are overventilation by mechanical ventilators, the administration of oxygen, and depletion of carbon dioxide can occur from mechanical ventilation, causing the client to be hyperventilated. Respiratory alkalosis results from conditions that causes overstimulation of respiratory system as well. The causes are panic attack, fever, pain, pregnancy, high altitude, sepsis, stroke, head injury, aspiration therapy, pulmonary embolism, pneumonia. These are all the conditions where a patient could not get enough amount of oxygen, so that the carbon dioxide builds up in the blood, which causes respiratory alkalosis. The symptoms are dizziness, lightheaded, tingling, numbness, muscle cramp, confusion, shortness of breath, palpitation, seizure, and loss of consciousness. In severe cases, patient may go to the coma, like same as in the respiratory acidosis. Hope you are getting my point. I'm saying that everything is good in a balanced amount. If both of these are going to abnormal, this both going to affect to our brain, so that which can lead seizure and loss of consciousness or altered mental status. So the treatment options for respiratory alkalosis are deep breathing exercise, so that patient can have a balanced normal pH level in the blood, and breathing control techniques, oxygen therapy, treatment of infection, fever, pain control, adjusting mechanical ventilation if over ventilating. Okay, now we go to the metabolic acidosis. It is the condition where blood becomes too acidic or low pH level due to accumulation of acid or loss of bicarbonate. If we see the patient report, we can see pH level less than 7.35, bicarbonate level less than 22 MEq per liter. So the bicarbonate normal level is 22 to 28 MEq per liter. It helps to maintain pH, and it is an ion. In low bicarbonate level, it indicates metabolic acidosis like diabetic ketoacidosis, renal failure, diarrhea, and in case of high bicarbonate, which is greater than 28 MEq per liter, and it indicates the metabolic alkalosis like vomiting, diuretics use, excessive bicarbonate intake can cause high level of bicarbonate in the blood. The causes of metabolic acidosis are renal failure, diarrhea, diabetic ketoacidosis, lactic acidosis due to hypoxia. In case of hypoxia, there is decreased level of oxygen in the muscles, which can lead to the lactic acidosis. And other causes are shock, sepsis, which also causes the metabolic acidosis. Now we go to the symptoms like small respiration, which is very important for your NCLEX. Other symptoms are fatigue, weakness, malaise, confusion, drowsiness, nausea, vomiting. In severe cases, there will be cardiac disturbance like arrhythmias, hypertension, and patient may go to the coma. Now treatment options for metabolic acidosis are treating the causes. First of all, we have to treat the causes, like in case of diabetic ketoacidosis, we have to administer insulin, intravenous fluids. In case of lactic acidosis, we have to improve tissue oxygenation like oxygen therapies. And in case of renal failure, we have to treat the renal failure like dialysis or other therapies. And we can also treat it by sodium bicarbonate therapy, because there is low level of bicarbonate in the blood. And we can also rehydrate with fluid containing electrolytes in case of diarrhea. Now we go to the metabolic alkalosis. It is the condition in which the blood becomes too alkaline. pH level increases more than 7.45 due to an increase in bicarbonate or loss of acids. In this condition, loss of acid from the body through vomiting or diarrhea, increased amount of base, which is S plus ion in the blood, and decrease in acids in the blood. If we see patient report, we can see there the pH level more than 7.45, bicarbonate level more than 28, partial carbon dioxide level may be elevated, or a compensatory response to retain carbon dioxide. And then causes of metabolic alkalosis are vomiting, which causes loss of gastric acid, which is HCl or hydrochloric acid, which leads to increase in level of bicarbonate, and then in gastric system. And then anti-suctioning can also lead to the metabolic alkalosis, which also causes loss of gastric acid, same as vomiting, and and the diuretic use also can lead to the metabolic alkalosis. Like thiazide loop diuretics cause kidney to excrete more potassium and hydrogen ion, leading to alkalosis. And then cystic fibrosis, in this condition loss of H plus ion via lungs and sweat, which also lead to metabolic alkalosis. And in case patient is using excessive antacid, which can also lead to a metabolic alkalosis, because antacid can destroy the acid amount or HCl amount in gastric system, which can also lead to a metabolic alkalosis. And the symptoms of these conditions are slow shallow respiration, hypoventilation, decrease in respiratory rate, muscle cramp, twitching, tetany, dizziness, confusion, weakness, fatigue, arrhythmias. And the treatment options are treating underlying condition, same as other conditions. We have to treat the cause of this condition, like potassium replacement, stop or adjust the dose of diuretics, treating vomiting, gastric losses, antiemetics, angiosuppressions, discontinue if patient is using or patient is under bicarbonate therapy, we have to discontinue that medicine. Okay, now we are going to solve this question. The question is, the nurse reviews the arterial blood gas results of a client and notes the following. The arterial blood gas analysis shows pH 7.45, partial carbon dioxide 30 mmFSG, bicarbonate level 20 MEq per liter, and the nurse analyzed these results indicating which conditions. So there are four options, which one is the answer. So there the pH is like 2 are the alkalosis. As we studied, the acidosis is a condition where there is low level of pH, which is less than 7.35, but in this condition there the pH level is 2 are the alkalosis. So this is the condition which can be like either metabolic or respiratory alkalosis. So first and last one could not be the answer for this question, so we have to choose between 2 and 3, which are related to alkalosis. So there is the pH is normal, and then partial carbon dioxide is low level. So you have to know the condition, there is low level of carbon dioxide, obviously that is the respiratory alkalosis. And there is bicarbonate level is less than the normal level, so the bicarbonate is trying to compensate. So this is the condition of having respiratory alkalosis, and which is compensated because bicarbonate is trying to compensate with such conditions. Okay, now let's do the another question. The nurse cares for a group of a client with acid-base imbalance. Which client does the nurse assess closely for the risks of respiratory acidosis? The first option is older adult client with stage 3 chronic kidney disease, post-operative client with decreased respiration, young adult client with diabetic ketoacidosis. The fourth option is pediatric client with 2-day history of vomiting.